The healthcare industry really doesn't know how to treat the patient like a customer.
That much is clear, yes.
Right? And so we want to have a day that is focused on customers, right, that are not big businesses that are insurance companies, but customers that are actually your patients, and just sort of shifting that perspective and teaching them through the leadership of these, icons in the consumer industry, what are the best practices there and how they need to shift their perspective. Technology has already settled in the healthcare space as it pertains to taking the majority, not all, but the majority of health records and moving them into the cloud and making that part of it digital.
Right.
And we obviously have lots of diagnostic devices, and so, in many ways the healthcare industry is technology enabled. But there are many ways in which it is not, right? So, so payments is a place where it's still not really technology enabled, right?
Right.
Especially as it pertains to consumer payments, the ability for consumers to manage their own accounts, marketing capabilities, right? I mean,
Right.
it's one of these. This is like baseline things you need if you're going to become a consumer company. You have to have marketing capabilities. The marketing technology is still, I wouldn't say nascent, but it's emerging at best, right? Compared to everything you see in the retail space and the web space, e-commerce, all those types of things.
Sometimes if I lived in rural America, I'd wonder why I paid taxes, because you're not getting a lot of services.
Yeah.
And you're not, rural communities have been the home of a lot of manufacturing, and which is the employment has dropped about 30% since the mid 1990s, I guess. So rural health and rural communities and what that means, and how those communities will sustain sustain a hospital or sustain a health system that is accessible, is going to be really tricky in a deflating environment.
For me, I think one of the big topics is, how does the rise of the millennial, right, now being the largest generation in the labor force, what does that do to the adoption of consumer behavior in the healthcare sector?
Well, unfortunately, we're going to have Neil Howe, the Hedgeye demographer,
yes.
There to talk about millennials.
Yeah.
He coined the term millennial.
Yeah.
And talk about those kinds of behavioral shifts. He's done a ton of work there, so that should be I'm really looking forward to.
Yeah, and that's an attractive segment of the market, right? I mean, really good margins,
right?
Yep. And I think the millennials are going to be really important for us to pay attention to, because they truly are a generation as a whole that believes everything should happen on their phone, everything,
right? And
everything should happen for them.
I've got three.
On delivery.
I've got three of those at home. Yes.
Yes. So right? And so as they shift and they start to take more responsibility and they come off of our, because I've got a couple too, as they come off of our insurance and they have to start taking care of these bills themselves, I think. Yeah, I think.
So the delay in the being insured under your parents' plan up until 26 has really delayed the impact, the consumer impact of the millennials, which is a fascinating issue. So the bulge, they should be hitting it right about now.
I think it's hard to get a good view on the breadth of activity in any one place. So I think that's one thing we'll be able to accomplish because we've brought all these key players in, the healthcare technology, the life sciences, early stage innovation, public markets. I think, policy, politicians, bringing all of them into the room to have sort of these very unique conversations, I think will give people a much more comprehensive view. I think that's important. I think also, you ought to be able to start to develop the next iteration of your investment thesis for the next 12 months. I mean, that's my hope is if you're coming. And then the third thing would be, if you have any interest in the private markets, there are going to be a lot of really great companies who will actually be there. And so whether it's for the purpose of investing or for just tracking those companies, there'll be lots of people there that will be happy to meet with you and start to build a relationship now. So as they grow to your stage of where you invest, you can have that relationship.